Okay, everybody, this is our first competency that we're going to go over that we felt was very important, and that is the observation of the CNA. You guys basically know this stuff, but it's going to be review, but you guys are the most important people there is with your eyes on these residents because you spend so much time with them. And it's basically very, very important that we are working on reducing rehospitalizations. And therefore, you guys are usually the first people that might notice a change. Okay? We're going to play the film first.
Hi there, I'm Kathy Getrust, and I'm an instructor in community health nursing. This videotape that you'll be watching today deals with making observations, how and what to report about those observations. One of the primary responsibilities of you, the healthcare assistant, will be to collect and communicate information. This information is collected by making observations about the patients that you're caring for. And then it is communicated by reporting those observations to the nurse or other healthcare team member, and also by documenting it in the patient record, similar to the patient record that I have here in front of me. We're not going to be covering any information about your documentation responsibilities in this videotape. That will be covered in another one. This one will focus on how and what kinds of observations to make, and then how best to report those. Observations are nothing more than information that you obtain from your patients by the use of your senses. The sense of seeing is one that you would use to make observations. Just looking at your patient might be that you notice that they're crying. Another sense would be your sense of hearing, things that the patient tells you. Possibly the patient would be telling you that they're not sleeping well at night. Another sense is the sense of smelling. Maybe your patient has a wound on their leg or abdomen, and you notice a very bad odor is coming from that. That's an observation that you need to be making. And lastly, the sense of feeling. You use the sense of feeling each time you check for a patient's pulse rate using their radial pulse and their wrist. And then this information can help health team members determine several things. One, has there been a change in the patient's condition? Let's say you have been caring for patients and all along they've been fully oriented. They've been managing to get up and assist with their cares independently. And suddenly you're noticing that they don't even know who you are. They're wandering around, having difficulty finding their room. Definitely a change in the patient's condition that is important for you to report immediately to the nurse. The information can also help determine if there is a new condition that's developing. An example might be you are bathing a patient and you notice that the heels of the foot is reddened. Certainly that's a change or a new condition that is developing. And by reporting that information immediately to the nurse, it will allow early intervention to begin, and so that will be providing the best care possible to your patient. Another thing that can be of assistance is this information can help determine the effectiveness of the medication that your patients are receiving. Let's say that your patient has a urinary tract infection, and some of the symptoms that they were experiencing was frequency of urination. They had blood in their urine. they had burning on urination, and the patient was started on some antibiotics. A week has gone by, and you notice those same symptoms are still happening. Patient is still experiencing pain and burning. Obviously, the effectiveness of this medication needs to be questioned, and it would be an important observation that you need to report to the nurse. Your responsibilities for observing your patients never ends as long as the individual is in your facility. It begins on admission and will continue upon discharge, will end only at discharge. There are some initial observations that are made when an individual is admitted to your facility. These initial observations are called baseline observations, and it is what is normal for that individual or what can be expected from that individual. If you are helping with the admission of a patient, it's very important for you to make these baseline observations. These initial observations then are used as a basis of comparison in the future. Let's say that on admission, you indicate that the patient's pulse rate was 68 beats per minute, and now it's several days later, and you take a pulse rate and it's 90. Well, this is obviously a change and needs to be reported to the nurse. Your student workbook provides an extensive list of observations that you can make. I will be reviewing some of the more important ones at this time. By far the most important observation that you'll be expected to make is an observation of pain. The Joint Commission on Accreditation of Healthcare Organizations, a group that is responsible for certifying that quality and safety of patients in hospitals, nursing homes, and other healthcare facilities is obtained, have indicated that patients experience considerable pain 50 to 60% of the time. That's an awfully high number. And as a result of that, this organization has recently developed some new regulations that we are all required to follow. One of those pieces of the regulation is that all of us need to be assessing or observing for pain in our patients and making certain that we are reporting those observations immediately so that effective pain management can be implemented. In addition to pain as an important observation that you will be making, another is the patient's mental condition. How stressed do you find this patient? How worried are they? What about their orientation? Do they know what time it is? Do they know where they are? Do they know who they are? Do they know who you are? All things that you need to be thinking about when you're observing patients' mental condition. How about their eating and drinking habits? What's their appetite like? Are they having difficulties chewing? Are they nauseated? Any problems with vomiting? Another is the condition of their eyes, ears, nose, and throat. Is there any redness of the eyes? Is there nasal congestion? How about any ear drainage? Possibly there could be sores in the mouth. All things that need to be observed and reported. Sleeping habits is another thing to observe for. How well does this person seem to be resting? Are they waking up frequently? Do they seem to be extremely restless? Tossing and turning a lot? Another important observation to be making. What's the temperature of their skin? Is it hot? Is there any discoloration? Any rashes that you notice on the skin? Any bruises? Breathing condition is another important observation to be made. Do you notice any shortness of breath? How about coughing? Any wheezing? Bowel and bladder function is another observation to be made. Be aware if your patient is constipated. What is their normal bowel pattern? Are they used to going to the bathroom once a day to have a bowel movement? Or is it more typically every third day or every second day for them? How frequently is this person urinating? Is there any blood in the urine or in their stool? Also, the activities of daily living that the patient has. Are they able to dress themselves? Are they able to feed themselves? How about their personal hygiene and bathing? How well are they able to walk? The last one that I will cover will be their body movements and posture. This is also a very important observation to be made. Are they stooped? Do they seem to lean to one side the majority of the time, or do they sit upright well? Do they have an ability to walk independently? Do you notice shuffling when they're walking? Do they tend to lose their balance easily? After making these observations, it's going to be very important, as has been stated earlier, to report them. Primarily, you will be responsible to report these to the nurse in charge of these patients that you're working with. When reporting this information to the nurse, always use the patient's full name and the room and bed number of this patient as well. This will make certain that you're reporting information accurately. Also, jot down the observations that you have made on a piece of paper, or carry a notepad with a pen and or pencil, so that the information that you do report is exactly as you observed. Another important thing about reporting your observations is be factual. Never try to judge a patient's behavior or the extent of pain that they may be experiencing. Some people are very expressive about pain. They may be writhing openly, they may be flailing around in the bed, they may be expressing very openly the amount of pain that they're experiencing. There are others, however, that are very stoic. By stoic, I mean very reserved and tend not to express themselves very openly. That individual might be experiencing just the same amount, if not more, pain than the individual that is very expressive. Culture also has an impact on how pain is expressed and can affect the pain response. So it's best never to compare patients. Pain experience is an individual experience and needs to be believed and reported as factually as possible. Reporting also always involves care and accuracy. There's a big difference between reporting objectively and reporting subjectively. Subjective reporting means reporting vague and incomplete information, or it also could mean that the reporting is being influenced by your opinions. Let me give you an example. You might report to the nurse some subjective information by stating, "You know, I think Mrs. Smith is just looking for attention. because she's been on her call light all the time. Objective reporting is much more accurate, and what you really should be reporting what you see, hear, feel, or smell. Using that same example, a better way of reporting that information objectively would be to state to the nurse, you know, Mrs. Smith has turned her call light on 4 times in this last hour. Now I would like you to watch a little role play situation. And while you're watching that, I would like you to see if you can pick up pieces of subjective information that's being reported by the healthcare assistant. And what pieces of information is she reporting objectively?
Oh, I don't know what in the world. Since I broke my arm, I can't do anything. Oh, Lordy, I can't get up. I just can't do things. I can't tie my shoes. I can't comb my hair. I can't go to the bathroom.
Hi, George. How are things going?
Hi, Kathy. I don't know about this one here. Ever since he broke his arm, he has just been complaining. He's getting lazy. He can't do things. He's been piddling in his pants. And this goes on all day long. I don't know what to do anymore.
Did you notice quite a bit of subjective reporting from that healthcare assistant? Let's talk about some of the subjective reporting that you saw. One of the first things she indicated to the nurse is that the patient was lazy. She also stated that the patient complained all day. A third piece of subjective reporting that she indicated to the nurse was that the patient was uncooperative. This is not factual reporting. This is giving too much of the healthcare assistant's opinion to the nurse. Objective reporting that could have been done would have been that the resident states, everything has been difficult since breaking my arm. Another piece of objective reporting would have been that the patient states, I just can't do anything. And a third thing that would have been objective reporting was that he indicated, did you notice that he was really struggling to get out of his chair? That would have been objective reporting. I'm going to have you watch a second role play. Again, look for those pieces of subjective reporting that this healthcare assistant reported to the nurse, and those that might have been objective.
So, Al, how are you doing today?
I'm doing alright.
I'm sorry I couldn't understand you.
Jesse.
Kathy, I really think we have a problem. He's been spilling his coffee. He's slurring his words. I think he's been drinking. I really do. I think he's hiding in this room. I really don't trust him.
There again, you saw this healthcare assistant making too many subjective reports to the nurse, didn't you? Some of the ones that I found is that she said she thinks he's been drinking. That was giving her own personal opinion. And she also stated to the nurse that he was probably hiding liquor in his room. She really had no basis to make that judgment. And the third, she said she just doesn't trust him, but yet she didn't really give any training program. You are about to embark on a very exciting career. Hi, I'm Kathy Getrust, and I'm a nursing instructor in community health. This training program will teach you how to drawing that committed responsibilities of being a nursing more objective reporting in that scenario for drawing that conclusion that the resident stated more objective reporting in that.
Now, why did you do that?
Assistant, and as a result, early intervention probably would not have been started as a result. In addition to you making reports to the individual nurse with whom you are working, there is something called shift report. Healthcare facilities, all that I'm familiar with, begin with the report at the beginning of the shift. Shifts typically run from 7 to about 3 p.m. and a second shift is from 3 to 11 p.m. and then the third is from 11 p.m. to 7 in the morning. Included in this shift report is information regarding all of the patients on your unit, in your healthcare unit that you are working on. And in that shift report would be a communication about all of those individuals' condition or any changes that those individuals might have experienced prior to this shift, most frequently in the previous 1 and 2 shifts before you. This shift report might include all of the nursing staff, or it may be just selected nurses that are part of that shift report. Healthcare assistants like yourself do not always receive all of the shift report. Frequently, healthcare facilities will be having you, the healthcare assistant, for example, if you're working the first shift, the 7 to 3 p.m. shift, will be assisting the patient in getting them up in the morning, helping get their teeth brushed and getting washed and ready for breakfast while the shift report is going on with the nursing staff. You then may receive report from the nurse after she or he has had the shift report, at the same time that you get your individual assignment for the day, and when that is being distributed to you. I'd like to leave you with a summary of the reporting guidelines that we've talked about today. The first reporting guideline is make sure that you do report your observations that you make in a patient's condition. Report them in a timely fashion. Be certain that you are reporting them as they occur. Report to the nurse in charge of your assigned patients. It would not be appropriate for you to report this to another healthcare assistant or to someone that is not responsible ultimately for the patients that you are working with. When you report to the nurse, be sure to use the patient's full name and room and bed number to be certain that the information is accurate and is received by the nurse about the patient that you are wanting to be certain that it is reported from. Use a notepad so that the reporting is accurate. If you don't have a notepad, be certain to jot your observations down on just a piece of scrap paper. That would be fine too. Report only factual information. No opinions, no subjective reporting. Report abnormal and unusual observations to the nurse promptly. Be certain not to wait till the end of the shift. Sometimes you're not going to know when you make an observation whether or not this is important enough to report immediately or if it can wait until later in the shift or even at the end of the shift. In those situations where you're not sure whether you should report it immediately or not, it is best to report it immediately. And if it isn't something that needed to be reported immediately, the nurse will make that determination. But you have taken the responsibility that you should and erred on the side of reporting immediately as opposed to waiting and preventing the possibility of the patient getting early assistance of treatment. Collecting and communicating information about patients to other team members will be one of the most important responsibilities that you will have. By performing these functions accurately, you will be ensuring that you are providing your patients with the very best possible care.
Okay. You should have been able to complete your test.
Yep.
I still got more to talk about. And I'm going to go a little faster. Okay, so continuous observation of all residents for signs and symptoms that may indicate physical and mental changes is an important part of the resident's care plan. A CNA's observation may lead to changes and adjustments to the resident's course of treatment. So the three things that you really need to pay attention to are changes in the resident's physical condition or appearance, changes in the resident's attitude, mood, emotional condition, complaints that the resident expresses. CNAs contribute information and observations that will help the team develop a plan of care. CNAs are responsible to collect data and report appropriately to the charge nurse. Follow facility system for identification and reporting of early changes in the resident's condition. And all of you have this in your packet. This is just to show you, if you've been here a long time, you would have remembered this from before, but we're going back to it. They're not quite sure how they're going to distribute it, but this is for CNAs to look at when they're charting and making sure that they're getting everything that's reported to the nurse that needs to be reported, because the early signs can save us from having a resident have to go out to the hospital. CNAs are most of the time CNAs spend their entire working time giving the care to residents. By doing this, they observe the patients and are able to determine problems that need to be solved as early as possible. Some of these problems need to be found out as early as possible in order to save the resident's life. It is necessary for CNAs to have the ability to observe changes in residents' physical, emotional, mental, and social conditions. A resident who might not be socializing well with others may have emotional problems or even deep depression, thus noticing and reporting it to the nurse and can make a big difference in the resident's outlook in life and well-being. Contributing information and observations that will help the team develop a plan is data collection and reporting. Even if such changes may be small, it's important to solve them early, or they may get worse and complicate the condition of the resident. Vital signs are equally important and should be monitored diligently, because a dramatic change might be a warning sign that an infection, illness, or depression is developing. And that's why a lot of nurses will tell you, I want those in the beginning of the shift, because that way they have time to figure out what's going on with the resident. You should keep in mind not to underestimate even the faintest sign of change, because this can lead to devastating results in the resident's health condition. Whenever in doubt, follow your gut and intuitions based on previous encounters of experiences and perform a suitable course of action. When collecting important information regarding the status of residents' health, keep in mind to immediately report a change in the resident's present condition to the nurse. Physical changes can be usually seen in the skin in the forms of lesions, bruises, rashes, swelling, and others. Other objective signs that can be visually observed are body weakness, coughing, vomiting, and mood changes. Documenting changes in the resident's health is an important daily task, and it requires skill, especially if the facility uses computers and other devices in recording. The use of abbreviations should also be in accordance with the facility guidelines in using medical terms and abbreviations. All entries should be signed by the person documenting it, and if corrections are made, then do it according to the guidelines of the facility. Consistently assigned CNAs have detailed up-to-date information about residents that is crucial for an accurate assessment and effective care plan. For example, if a resident experiencing a change in mood or appetite or functional ability, the consistent assigned CNA will note and report it immediately. Over time, through provided care daily from the same person, a consistency assigned CNA will know their residents' likes and dislikes and their customary routines. They will know what is calming and soothing for each resident in their care, as well as what will surely agitate them. They know the best time for each care practice, and they will note subtle differences that may indicate a budding change in condition. With support, CNAs can make suggestions for adapting the care plan to more effectively support the resident. This kind of information from CNAs transforms the assessment and care planning from routine exercises to timely, relevant, effective processes. CNA know the details of a resident's day-to-day life, activities, and recent experiences that families are mostly interested to hear. They contribute to the needs to families, such as clothing, toiletry, or hobby supplies. Signs of change of condition. The care plan does not fit the description of the resident. Report if resident seems different than normal, such as a resident not wanting to go to the dining room for breakfast, and this is very out of character. Talks or communicates less. Overall needs more help with ADLs. Pain new or worsens. Participates in less activities than usual. Eats less. Choking on food and pocketing food. No BM in 3 days. Drinking less. Change in weight or increased swelling of the extremities. Agitated or nervous more than usual. Appears more tired, weak, or drowsy, or resident states feeling more tired, weak, or drowsy than usual. Seems more confused or mental status change. Change in skin color or condition. Appears or complains of difficulty breathing. Help with walking, transferring, toileting more than usual. Changes in normal vital signs for that resident. High, low, or irregular. That should be immediately reported to the nurse. Anyway, those aren't all of them, but those are some of the ones that you guys are always doing.